I have always thought people like passionate people.
But we're
Jump.
also weirdos, so,
Oh, don't listen to us.
don't listen to us. It's
Come on.
terrible.
Look at us. We call ourselves Digital Doc and GamerDoc. Who are
Right.
these weirdos? Welcome back to Digital Doc Games, where we explore how games help us grow, connect, and heal. Today, I am joined by the GamerDoc, Dr. Lindsey Migliore. Lindsey is an esports medicine physician, a killer Fortnite player, and founder of GamerDoc, where she applies medicine to the field of competitive gaming with the goal of improving performance and expanding the lifespan of the esports athlete and gamer. Is gaming a topic you would like to have brought into the doctor's office? Let me know in the comments below. Well, I am really excited to learn more about esports medicine, to learn more about GamerDoc. Lindsey, can you tell me what is the GamerDoc and how did you become said GamerDoc?
So, that's a good question. Uh, I think branding is really important. You went to med school, I went to med school. We were taught a lot about the Krebs cycle and the loops of Henle and a lot of biochemistry, a lot of pharmacology that we have never used. Um, but what they don't teach you in med school is business.
Right,
Um,
right.
and of course it's not called business school, but it is kind of important if you're going to be a lot of physicians run their own practices, a lot of physicians run their own brands, and we also didn't learn about nutrition, but that's a side note. And I think
Nah,
that
yeah,
branding is really important. Your brand says a lot about you before people even meet you, before people even hear what's coming out of your mouth. They've decided if they like you or not. They've decided what you stand for. They decided what you represent. And so branding for me was finding something that represents who I am and what I want to do.
hmm.
And GamerDoc, I'm a doctor for gamers, but I'm also a doctor who games.
Right, right.
So that really was what solidified it for me. And then from there it was kind of easy. So what I'm doing is both of those things. I'm a doctor who happens to game, and I'm a gamer who happens to be a doctor. So
Yeah, no, absolutely. And it's such a great point. I mean, talk about the branding of a gamer doc. When I decided to start this channel, the first thing I looked was what should my name be? And obviously the first thing
yeah.
that came to my head is, hey, I'm gonna be gamer doc. And I did a quick Google search, and that's how I found you, Lindsey. So you got there
Yeah.
first.
Well, I actually didn't get there first. There's I think he's from the Europe. He's a Overwatch player, notorious for anti-hacking and anti-cheating, who now
Okay.
works for Riot. So and I'm sure he was superseded by someone else. There are no original ideas in this world. So
Right, right.
yeah,
Yeah. No, the doctor brand on Twitch is highly distorted. Obviously, this don't get confused with the hot topic of Doctor MD versus PhD. That's not what I'm talking about.
yeah,
I'm talking about
right,
the gamer doc versus Dr. Lupo. So,
yeah, yeah.
um,
Yeah, Dr. Lupo gets a pass though because his dad was a doctor and he lost his dad at an early
okay.
age.
So I didn't know that.
Or not an early age, I think he lost him recently. But so Dr. Lupo gets a pass. Dr. Disrespect, no,
That's right. That's right. No,
no.
no
But
respect for the
he'd be a
Dr.
surgeon
Disrespect.
if he was.
Yeah, maybe with that, he might have to shave some of that mustache and
Yeah,
that
that's
wig
true. That's
for
true.
sanity reasons. But yeah, I just want to thank you for being here. I want to thank everyone in the chat who's watching live. Hopefully, our stream will kick together soon. But thank you for tuning in to Digital Doc Interviews, where we talk to people using video games to help have a positive impact on the world. People like Lindsey. Remember, you can watch Digital Doc Interviews live on Twitch, where you can participate in the show. But if you can't watch live, no problem. You can make your way to youtube.com/digitaldocgames, where you will find all of our interviews, let's plays, and reviews. As we get going and you feel the need to hit that like button or follow and subscribe to this channel on Twitch or YouTube, your support means so much to me. Welcome aboard the care team. So, GamerDoc, what is esports medicine?
So competitive video gaming is huge, right? It's growing every month. It's growing every day. Aside from marriage counselors and Nintendo Switch and dogs, has won the only people who have won this pandemic.
Right, right.
Competitive video gaming, known as esports, is a $1 billion industry.
Yeah.
And that's separate from gaming, right? That's not your Candy Crush wins. That's not your in-game Fortnite skin buys. That's the competitive gaming industry. It's generated $1 billion in
Wow.
revenue. A lot of it's from sponsorship and marketing,
Hmm.
obviously. Um, and so there's a little bit of that, but these people are playing their title. So whether it's Dota or Overwatch or COD, they're playing their title for hours upon hours upon hours.
Right.
And they're sitting at their setups that may or may not be ergonomically set up. They are not warming up, not stretching, not cooling down. If they're a member of an org, they might have some nutritional support, they might have some therapy support, but otherwise, not a lot of health and wellness initiatives.
Yeah.
And they're getting injured. They're
Yeah.
getting injured, and no one knows what to do with them after they're injured. So that is what I'm doing, is figuring out what to do with them.
Right. I mean, so this is a really interesting problem because it's not something, and I imagine you face this question all the time, but it's not something that you would really think, whether if it is an issue, if you're aware of the issue, that it's necessarily something that can be addressed. You think of sports injuries, we think of contact sports like football, soccer,
Mm-hmm.
some of the big ones. How much of a problem is this? I mean, what type of injuries are these gamers, are these athletes experiencing?
Yeah. And you're right about the mechanism, right? It's not a collision sport. They're not contact sports. You're not getting acute injuries. You're not getting ruptures
Hmm.
like you would an ACL. But it's a huge issue. It's actually a lot bigger of an issue than it is in traditional sports. Health is much worse in esports because there is no awareness around it and because there are no prevention initiatives around it. And so if you play, we all play middle school soccer, right? Or elementary school soccer, or some sort of sport.
Right.
And you probably got injured, right? You probably sprained your ankle or broke a finger. And most of us don't have those injuries still, right? My
Hmm.
my broken ankle healed, my broken finger healed. It didn't have post concussion syndrome anymore. And so when you play traditional sports, you see that you get injured and you heal, and you get
Right.
injured and you heal, and you get injured and you heal. Um, in esports, people don't know that you heal. People
Hmm.
don't know that you get injured and you heal. So once they start feeling pain, instead of saying, "How can I fix this?" they say, "Well, this is my life now."
Yeah. Yeah.
And they don't address it, they don't go to the doctor, and so they end up having to retire at 20, 21, right when their careers are picking up because of these untreated injuries. And that's why it's a much bigger issue than it is in traditional sports, is because of the culture and because of the lack of resources.
Right. No, it's really interesting, and it makes me wonder, what is the awareness from the players? I mean, you say there's at least not awareness of that there's things that they can do about these things. There's
Mm-hmm.
management, there's treatment. Is there awareness that actually, hey, this injury might be due to my career as a gamer, as an esports athlete?
It depends on who you're talking to. Uh, the funny thing is that I'm publishing a book this year with Springer Medical on esports medicine, and a lot of what's in it, not a significant portion, but a significant a chunk of it is extrapolated from existing data
Hmm.
from similar populations, because we don't have the data, we don't have the science, we don't have the studies. So it's hard to say this injury is from gaming because the injuries aren't happening while you're gaming. And
Right.
and bear with me for a second, because even for the most educated, this is somehow hard to understand for so if you're listening at home, just give me a second. Um, we talked about the traditional sports injuries. You get hit in the side of the knee, you tear your ACL. You land funny, you sprain your ankle. That's an acute injury, right? It happens immediately. You have a healthy tissue that breaks
Right.
because of the force, the overwhelming force placed on it that your tissue cannot fight against. In gaming, what happens is you are doing these repetitive motions for hours and hours, weeks and weeks, months and months, years and years. And so, your tiny little muscles and your tiny little tendons of your hand and wrist get little tiny tears in them. Not
Mm-hmm.
huge tears, right? Not huge tears enough to break them or to tear them, but tiny little ones that you can't see and you can't feel. And those tears get repaired, right? And then you get another tear and it gets repaired, and then you get another tear and it gets repaired, and you get another tear and it gets repaired. But after a while, you get a tendinopathy, right?
Right.
You get the fibers of your tendon are supposed to be parallel lines, right? Like a 8-lane expressway. But with all these chronic tears, these micro traumas, they start to overlap, they start to get wavy. And that architecture of that tendon cannot resist the same forces that a normal tendon can. So you play video games for 5 years without resting, without stretching, without strengthening, and then you go bowling. And you go to throw the bowling ball, and all of a sudden you feel a pop in the back of your wrist, right?
Right.
And you've now ruptured that tendon or fully torn that tendon. Why did you feel fully tore that tendon? It's not because you went bowling. It's because of how bad your tendon was before that. And all of a sudden, that slight increase in force that you should normally be able to take care of, you can no longer take care of.
Right.
And those are the injuries we see in gaming. So people don't put that together that I got injured at bowling though. How's this from gaming?
Right. Right. Absolutely. And that opens it up, so I think you can see how big this problem is. I mean, to me,
Mm-hmm.
right, this is not something that is just for esports players, right? I mean, this
Mm-hmm.
is for gamers. How many, the average gamer, how many hours a week do they spend, you know, playing video games? I know for me growing up, when I used to play Call of Duty or really any competitive shooter, um,
Mm-hmm.
downstairs in my parents' house, downstairs, in my living room, I had what was called gaming position. And if I wasn't in
Mm.
gaming position, I couldn't play, right? I needed to
Okay.
be in this position. So what that was, there's this little coffee table, and I had to have arms out on the coffee table with a pillow under my hands so that I don't, I can stay steady with my controller. Um, and that's the only way I could game. I now absolutely am sure that my chronic back pain and the fact that I'm always cracking and feel, like I need to stretch stems from that fantastic gaming position.
Yep. Yep. You're also just getting old. No offense,
Ah,
but we're all
shoot.
getting
No, I'm
old.
just
So
trying to make excuses. Lindsay, come on.
yeah,
Um,
I like to call that gamer posture nerd neck.
nerd neck. Okay, gaming
Mm-hmm.
position, nerd neck.
Yep.
Fair, fair. So, it sounds like, or when is the right time for someone to come find an esports physician, for someone to come find you? Is it the treatment, or I'm guessing there's a lifestyle management aspect to this as well?
So, I've been in the field for almost 3 years, 2 years, almost. I don't know, sometime greater than 1 year. Um, and I'm one of the earliest physicians in the field. There's a couple others, uh, but the physical therapists have been here for a long time.
Right,
The
right.
physical therapists have been here for a lot longer than us. And physical therapists are great at this stuff.
Yeah,
They're great at injury prevention. They're great at exactly what we're talking about. And that really is the foundation of esports medicine. And that's what's cool about this field, because all the other fields that are there, like what more are we learning about cardiology, right? Like what more are we learning about pulmonology?
sure.
Sure, new treatments are being created, but we know everything we're going to know about the lungs. We know
Right,
everything we're going to know about the heart. Neurology would be the only analogy that I could think of. We're building this field, and the way that we're building this field is with a focus on prevention,
right,
because the pharmaceutical companies aren't involved in this right now, right? And so no one's getting insurance reimbursement for anything we're doing. So what we're doing is we are building this on prevention.
mm-hmm.
Um, and that is the foundation of this field, is because everything is preventable, right?
Right.
And these injuries aren't happening to people my age. They're happening to 18-year-olds, 19-year-olds whose bodies are like beautiful little rubber bands that can be stretched and recoil perfectly. I'm like a rubber band when you put it in the freezer for an hour. So, so the focus is on prevention and stopping these injuries from happening. So that's when you want to start paying attention, is when you want to be proactive about your health, or if you want to take gaming a little bit more seriously.
Yeah.
Because gaming is a pastime, esports is a career.
Yeah.
And so if you want to get involved in esports, then you should start paying attention to what we're saying.
Definitely, definitely. And so, how does let's say someone does want to take this, how does, a two-part question, right? How does someone find you? And how do you find your patients? How do you work with them? Is this uh, the gaming population? Is this something, are you gaming with them? Are you working with them remotely? Are they coming to the clinic?
That's a really great question. If you ask me last month, my answer would be different. If you ask me next month, my answer is going to be
I
different.
love it.
Another great thing about this field is that I can do what my passions are.
Yeah.
Um, and because if I'm one of the only people doing this, so if I want to do direct patient care, I can. If I want to do administrative stuff, I can. If I want to work with esports orgs, I can. So patients have found me primarily through Twitter.
Hmm.
I would love to talk about the impact of social media later and how, because I built my brand entirely on Twitter. That's the only reason people know me is I got started on Twitter.
Right.
And I had never had a Twitter account before that. So yeah, that people have found me primarily on Twitter. They found me through my website. I don't really take private clients anymore. I'm kind of moving away from that because if I were to see evals take me like 1 to 2 hours, follow-ups about an hour. So if I fill my schedule with this job, which is one of my three jobs that I have right now, um, that's 8 patients a day.
Right.
If I'm
Right.
working 5 days a week, that's 40 patients a week. So instead, what I'm doing right now is working with orgs, working with esports orgs, and working with nonprofits and other companies. And I'm training the people who are making the curriculum. I'm training the people who are coaching, the people who are enacting the health and wellness protocols. Um, and I'm working with them to create the foundation of health and wellness programs for them, which
Wow.
is really fun for me and really
Yeah.
interesting for me. So I forgot the second part of your question,
No,
but
I mean, I think you kind of addressed both of them really, really nicely. So yeah, I mean, I'd love to hear a little bit about how you got here. You're an esports physician now. You're working with these organizations. You're doing really, really great things. Uh, what was your path? I mean, you completed a residency. Can you talk about your experience with residency?
sure. Uh, so I have been a gamer my whole life. I've been gaming since I was 6 years old. I actually just got my first video game tattooed on my back
I saw
yesterday, two
that.
days ago.
Wow, is that cool? Wow, is that
Thank you.
cool?
I'm
Because I've
excited about
seen a
it.
couple different, tattoos and, different things with the Triforce, but that I really think is the coolest one I've seen.
I'll tell my tattoo artist you
There you
sent
go.
that. So I've been gaming my whole life, and you know this. You went through med school. As soon as someone finds out you're in med school, what's like the first thing they ask you? I have this rash. And in the beginning of med school, it's cool, right? Your first year, people are you've been working your whole life to go to med school. You're in
Right.
pre med. Remember when people would ask you medical questions when you were pre med, and you're like, I've taken physics. I'm not sure.
But you also
Um,
felt this almost, at least for me, this responsibility to like, so I would spend, an hour looking it up to try and become an
yeah,
expert.
exactly,
Yeah.
exactly. So I went to med school, and people were asking me questions about their necks and their rashes and their coughs, and you have that one random cousin who calls you up for antibiotics, and this was happening in real life, but I was also gaming most nights. I was in a long distance relationship, and I had a yoga addiction, but otherwise I was spending the rest of my time either studying or gaming.
Right.
And my online friends were doing the same thing, right? They were asking me questions about their health, but the questions they were asking me about were questions that I actually didn't know the answer to, which was,
Hmm.
why is my pinky numb? Why does my thumb hurt? Why does my neck hurt? And the answer eventually becomes, I don't know, go to your doctor and leave me alone.
Right. Right.
um,
I'm just a med student.
right. And so what they say in so they would go to their doctor, and what they would come back with was, well, my doctor told me to stop gaming. It hurts when you're gaming, stop gaming,
Right.
right? That's such an easy answer for physicians to say.
Sure.
um, And that just like isn't an acceptable answer to me and has never really been an acceptable answer to me. So when I was starting to think about next steps, when I was, getting into my third year of residency, second year of residency, I started thinking about what I wanted my life to be like,
Yeah.
what I wanted to do with my life. And all my friends were going off and, making ridiculous sums of money, doing spinal injections all day or being sports medicine doctors. And I always thought that was cool. And I always wanted to do that. I always wanted to have money. But then I realized, like, life's just way too short to do stuff that you don't love. Um,
Absolutely.
and so I sat and I thought about it and I was like, what do I love? I love gaming. I love gaming. That is my, I love my wife and then I love gaming.
Right.
And that is what I love at the end of the day. And it all kind of came together when I was at a medical conference and my buddies getting injured while gaming, me wanting to make a career for myself, and so I went home from the conference and I bought the URL and got the Twitter name and then started from there.
Yeah. This is my favorite part of the interview, and this is the part that I was so excited to get to. And just what you last said, how life's too short to not do what you're passionate about, and how you found a way to combine your two passions. And that's
Mhm.
exactly what I tried to do and am trying to do with digital doc
You
games as
are
well.
doing.
Thank you. Thank
You are doing.
you. Was there ever a point where you felt like you needed to hide half of yourself, depending in what environment you were, the gaming side and the medical side and the gaming?
Yeah, that's a really good question. I speaking as someone who came out when I was 18 years old, I'm used to hiding a part of myself.
Sure.
I also hid my gaming from all of my friends. I being cool was really important to me in high school, and so no one knew I was a gamer. Right, I was a jock, but I wasn't a gamer.
Right.
And then in college, I wasn't a gamer, but I was gaming. And it wasn't really until I became sure of myself as a person that I accepted the fact that I was a gamer.
Right.
And then once I joined medicine, I mean, the bad advice starts coming the moment you decide to become a doctor and will not stop
Mm-hmm.
ever because
Because everyone
physicians
has an
love to hear
opinion.
themselves talk.
Everyone has an
Everyone has
opinion.
an opinion.
And their opinion is
And
fact.
oh yeah, you can't argue with the doctor. No, why
That's
would you
right.
argue with the doctor? And so the fact that most physicians don't understand what esports is at all, let alone esports medicine, is like when you tell people what you do, it's just unfathomable to them. It's just that you can see the steam coming out of their old ears.
Right.
Um, and so yeah, so I don't hide myself anymore. I didn't have to hide my gaming side with medicine because I just refused to. But if I was a little bit different, I probably would have.
Yeah, I mean, so you did a sports medicine residency, right?
Physical medicine rehabilitation.
Oh, that's right, pm&r.
Yeah,
Um,
yeah.
were they supportive, your residency directors, when you told them that you wanted to go into being an esports physician?
It's a really good question. There have been people in my life who have wanted what's best for me, um, but haven't understood me enough to understand what's best for me.
Sure, sure.
And I was an excellent sports medicine candidate. I was going to do a fellowship, right? Um, I was an excellent sports medicine candidate. I even went on interviews, and all we talked about the whole time was GamerDoc. And every single one of my fellowship directors, prospective fellowship directors, was like, "Come here, I'll give you whatever you need. We'll build the Center for Esports Medicine."
Uh-huh.
Um, and I withdrew from the match. I decided that I didn't want to do it anymore. And for people in your residency leadership, that's hard
Yeah,
because what makes your residency attractive is where they go after. And to say that, one of your residents is not employed by any cool company
yeah.
isn't attractive.
Right,
So,
right.
That's how I'm gonna answer that
Ooh,
question.
man, yeah, no, that's good. Definitely something that I'd like to see change, right? Especially in this new future that for me, I'm in digital health, and even
Mm-hmm.
before COVID, as a med student, I had this idea, this gut feeling that digital health was going to explode. Of course, then COVID happened and exploded from COVID. Um, but there's so many ways that I always say this. In 2020, there's so many ways to practice medicine, and
Mm-hmm.
that's not restricted to practicing in the hospital.
Yeah,
So there's
totally.
this group, I don't know if you've heard of them, called Doctors of Gaming. And it's a really cool group. They have a Discord, they have a Reddit. I don't know how many, I don't know, like 500 doctors in there and medical students, all who are gamers. And I've been, browsing the Reddit from this channel, and there's a fair amount of the members who have brought up the issue, what we're talking about, the feeling that they need to hide their gamer selves in, whether that be the match process or residency to their colleagues, whatever it is. What's your advice for them?
I mean, life's too short. Life's just way too short to be anyone other than exactly who you want to be. If people are going to judge you because you're a gamer, then those people probably suck. And why are you wasting time on them?
Right.
And I know that's a position of privilege that I say because I'm my own boss and I'm not trying to get a fellowship and I'm not going to
Sure.
get a
Sure.
residency. But I can tell you, like, I mentored a lot of med students and a lot of interns, and being boring is worse.
Right.
If you hide that part of yourself, which is probably the most interesting part of yourself because gaming is awesome, uh, it's better to have that factor, that different factor, than to be just another one of the crowd.
Yeah.
And that's what separates people when you go for positions. It's, I mean, it's who you know, but then it's after that, it's different. What makes you interesting?
Yeah, and I think for me, it's the confidence, right? Whether it's gaming, whether it's playing the flute, I don't know, whatever it is, whatever your
Yeah,
passion is,
exactly.
have the confidence. And obviously, every specialty is different. There's the stereotypes that are often true for different specialties, and maybe it's different
So
based on the
true.
case. But if you are confident and show that you have an interest, I have always thought people like passionate people. Um,
Hmm.
yeah, so I think I echo what you say there. That's
Yeah,
really great.
but we're
Jump.
also weirdos, so
Oh, don't listen to us.
don't
We
listen to us. It's
come on.
terrible.
Look at us. We call ourselves Digital Doc and Gamer Doc. Who are
Right.
these weirdos? Going back to the esports medicine real quick, if there's someone watching either now or later on YouTube, and just on their own, they want to pick one thing to do, and it could be more than one thing, to have a healthier gaming lifestyle. What advice would you give them?
Thing is that knowledge that you can get injured, and awareness that you can get injured, and awareness that it's probably completely preventable.
Uh huh.
Because if you don't know there's a problem, then you can't address the problem. So for me, when I'm gaming, I try and warm up, and it's not like I'm running sprints outside. It's just I'm doing wrist circles, right? I'm stretching my fingers back. I'm doing thumb stretches for 30 seconds before I sit down.
Yeah.
And the thing is that anyone who's ever treated a patient or that worked in an outpatient setting, you're not going to get buy-in from the this will make you healthier,
Yeah.
right? Most people don't care about that. Most people don't care about that. The thing about warming up and the thing about stretching beforehand is that it makes you a better gamer,
Yeah.
right? If you warm up, if you increase your blood flow, you're increasing the temperature of the muscle, increasing the elasticity. You're also making nerve transmission easier. You're increasing the enzymatic activity of your muscles. There's lots of benefits, performance benefits to warming up aside from injury prevention, and your ECU won't explode.
Yeah.
So warming up and doing, like, you don't have to use, if you go to YouTube and Google my name and warm up, you'll find a warm up routine, but you don't have to. Like, intuitively, you know how to warm up for gaming. What are the motions you're using? What are the joints you're using? Warm those muscles up.
Right.
Wrist
Right.
circles. Just do a wrist circle.
Yeah.
So easy.
I love it. And can you do it? Is this also something that can be done like a break, a mid gaming break.
100%, 100%. I also love star jumps. I don't I like made this up. Like I mean it's I didn't make up this exercise, but I don't know what they've ever been called, but where you keep your hand in a tiny little balled fist and then you extend your fingers back and abduct and spread your fingers wide and then backwards. And these just reminded me of star jumps
Yeah.
in gym class. So I just called them star jumps for your hands.
Yeah,
Do
jazz
you make
hands,
these?
start up,
Yeah,
jump.
jazz hands for the carpal tunnel
That's right.
test. But if you just do this, like my arm's tired right now. My
Yeah,
arm's tired. Do those in between games. You know, it keeps your hand warm, it keeps the blood flowing, and it it stretches you out. So
right. I love
I
it.
recommend
Okay, well, we're taking it. I'm gonna say right now, from this moment forward, any gameplay stream that Digital Doc Games does before, we're gonna have a stretching. We're gonna call it the GamerDoc
Love it.
stretching session, and
Love
we're
it.
gonna do our star jumps. We're gonna do it all.
Let me give you my favorite one though first because this will make you cry. So after you're warmed up, you never want to stretch pulled muscles, right? You want to have that elasticity before stretching. You put your hand in front of you and tell me if you can't see me, but I think you can.
I gotcha.
And you put your hand in a fist, and keeping this hand in a fist is very important.
Okay.
You grab the top of your hand and you, oh my God, it's tighter than the last time I did this. And you just pull down, and you should feel the stretch over the top of your.
This is a physical diagnosis test, I believe. Is that, it's not Tennell's, whatever it is, but I remember it's like really, I remember doing this in med school and it was very painful.
It's a Cosen's test varietal.
Okay,
Cosen's is middle finger extension.
okay,
So and the tendency is to release the hand that's balled, but you're not getting the stretch of the muscles that we want when you do that. So holding that for like 60 seconds and
oh
then
my
doing the
God.
other side. And it's yeah, and one side will be tighter than the other. For me, it's my non-dominant hand, which is interesting. But that's my favorite stretch because unless you have someone with like Ehlers-Danlos, it's gonna make them
Right,
feel it.
right, for sure. Awesome. Well, I'm super excited to try that. Before we close the interview, I have one more question. Also, if there's anyone in the chat right now that has a question for GamerDoc before we close, now's the time to get it in. I want to ask you, Lindsey, what is the most impactful game that you last played? So that is something we explore here on this channel, games that make a difference, games that make us feel things. It could be the last one or just the one that comes to mind.
Everyone's gonna make fun of me. Everyone knows my answer. It's Fortnite. To me,
It's
it's
Fortnite.
Fortnite because what gaming is to me, and not esports gaming. What gaming is to me is a thing I do with my friends. It's a way I keep in touch with all of my old friends. It's a way I've made new friends. Like my social life has been relatively unaffected by COVID because I see all my friends still, right?
Right.
I see them all online. I talk to them all online. Um, and so Fortnite is a way that I play with my buddies from med school. I play with my buddies from residency. I play with my new friends. I play with everyone. And that's the feeling that gaming brings to me is that sense of community. Like you're never gonna be alone if
Yeah.
you have video games. You're never gonna be bored if you have video games. Gaming has always been, and Fortnite has been this game that I've played for longer than any other game. And I introduce all my new friends to it, even if they're like, that game's for 6-year-olds.
Right.
And then they
Right.
play it and they get obsessed with it. So, Fortnite is going to be the most impactful game for a while for me
Yeah.
until I have a better community game.
No, I love that answer. We could probably, I don't play Fortnite. I play other battle royales, but I do appreciate Fortnite for really the innovation. They
Mhm.
changed the game in video games.
Mhm.
No pun intended. And
Yeah.
we could have a whole other conversation about that, but we'll save it for now. Lindsey, thank you so much for coming. All technical difficulties withstanding, I think this was a fantastic interview. I really love talking to you. If people want to follow your journey, learn more about what you're doing, what's the best way for them to do that?
Twitter. I am on Twitter at GamerDoc _ rolls off the tongue. That's where you're gonna find most of my content. That's where you're gonna find whatever I'm doing.
Awesome.
I'm usually on. You usually find me on Twitch 3 to 4 to 5 days a week on various channels. So that's where you'll see me. And that's the best place to really contact me as well.
Cool, guys. Go follow GamerDoc. Go follow her. I promise you, I've joined for a couple of her streams. She is a mean Fortnite player in the best way possible. Lindsey, thanks so much for coming along. For that, that's everything, guys. If you enjoyed the interview, please consider following or subscribing to the channel, whether you're on Twitch or YouTube. I see we have a couple new followers here. PVC Leslie, Randiose, Crafting Rogue. Thank you so much. Welcome to the Care team. It's great to have you. We will be back for more streams, for more interviews. Keep it locked right here at Digital Doc Games. Thanks so much, and game on. Bye, guys.